Happy Saturday! This is Miri, and today and this weekend I only have one goal, which is to make a new video on the infant reflexes. And to do so, I just completed making a PowerPoint presentation for you guys. Now, this is not my typical method of content delivery, but I thought it would be helpful this time around because there are a lot of visuals, and I thought they would be helpful in helping you visualize and conceptualize some of these reflexes. Now, before I get started, I just want to mention that the age ranges that I use for when these reflexes emerge as well as integrated are approximated. And you'll find, depending on the source that you use, that these age ranges differ a little bit. So don't focus so much on memorization. Rather, the focus of this video will be to help you really understand and conceptualize what these reflexes are and how they enhance or hinder our occupational performance if they are retained. One of the most difficult things for me when I was preparing for the board was not actually memorizing this stuff, but applying it clinically to understand the ways that it can limit our everyday ADLs and simple things like getting up out of bed and our movement and our posture and coordination. So those are really the things that I want you guys to pay attention to and try to understand. I'll try my best to make it as simple as possible, but you may have to review it yourself one more time, and I'm going to encourage you guys as you follow along to do these movements yourself. Like, when I show you guys baby movement of like ATNR, for example, I want you to do it to get that muscle memory. Okay? All right, let's get started. Now, the way I'll be going over the content of this video will be by breaking it up based on 3 broad categories to help you remember the age of onset. And these 3 categories will be based on when the reflex first emerge and whether or not they get integrated. So the first part will cover just the reflexes that emerge in gestation before birth. And the second part will be those reflexes that emerge at birth and shortly thereafter, and all of which get integrated at some point. And in the third and final portion of the video, I'm going to talk about lifetime reflexes, which means that they do not get integrated and they persist throughout our lifetime. So part 1, reflexes that emerge before birth. These are observed and integrated within the first year, although they may reoccur after injury to the brain, and they're important for survival, posture, as well as alignment of our head with the body. So let's begin with the rooting reflex, which emerges around 28 weeks in gestation and gets integrated by around month 3. Now, to test for this reflex, you would simply touch or stroke the baby's cheek or mouth or lip area, and the response you'll see will be the baby's head or tongue or mouth in this case turning and moving toward that touch or stimulation. And the baby's doing this automatically, you guys, to search for and to locate the food that he needs to survive. So talk about self-preservation and survival skills. So that's why this reflex is sometimes known as the searching reflex, because rooting allows the baby to find the food that he needs to survive after he comes out of the womb. Now, once the baby has searched for and found the food that he needs with the rooting reflex, that's when the suck-swallow reflex comes into play. Similar to the rooting reflex, the suck-swallow reflex also exists to help the baby survive, because this is what allows the baby to actually eat the food that he finds. So this emerges around the same time as rooting, 28 weeks in gestation, and it should be integrated by around month 5 or so. To test this reflex, you would simply place your finger inside the baby's mouth, and the response you'll get is a strong rhythmical sucking. So remember, the rooting reflex allows the baby to search for food and locate that food, while the suck-swallow reflex helps the baby to actually eat the food that he finds. Moving on to traction. Also emerges at 28 weeks in gestation and integrates by around month 5. You can observe this reflex when you try to pull a baby up by the forearms from a lying to a sitting position. So pull to sit. And what you'll see is the head lagging at first because there's little control over that head right now, head control. And it'll be followed by a complete flexion of the upper extremities, including the hands. That means even those tiny little hands will momentarily and involuntarily grasp in order to hold on while it's being pulled up. So the functional importance of this reflex is to facilitate that reflexive momentary grasp, which is caused by the total upper extremity flexion. And this is preparing the baby to eventually gain voluntary control of grasping. All right. All right, next, let's move on. The Moro reflex. This one emerges in utero around 28 weeks in gestation and integrates by approximately month 6. Now, this reflex occurs when the baby is startled in response to any unexpected changes in the environment, which can include loud noise or rapid movement, or even the baby's change, like sudden change in position. To test for this reflex, you would create a falling sensation by rapidly dropping the baby's head backwards. And what you'll see is an immediate arm extension and abduction, followed by a second phase, which is arm flexion and adduction, and usually crying. And as with all the other reflexes we just discussed, the Moro reflex also exists to serve an important function, and that is to act somewhat like the baby's alarm system or fight or flight response, because it gets triggered when the baby feels a loss of support and feels a need to protect itself. Next, we're going to talk about the plantar grasp reflex. This one emerges around 28 weeks in gestation, like all the previous reflexes we just covered, and integrates by approximately month 9. And to test for it, you'd apply pressure with your thumb against the sole or the ball of the foot, and what you'll see are the toes curling in flexion. In fact, if you've been around babies, you might have noticed that even without any pressure or touch to their feet, their toes are often resting in that slight flexion. Have you guys noticed that? And that's because this reflex and the pressure from flexion of their toes provides tactile input to their feet. And this tactile input, you guys, is very important because it's what prepares the baby to eventually position his feet in standing so that he can eventually go on to walk and run and maintain balance. Okay, so if this reflex is retained, foot positioning will be that much more difficult because the child may experience hypersensitivity to touch as well as gravitational insecurity when standing. So all of these things will make it really hard to walk, run, and maintain balance in motion. All right. Next up, the Galant reflex. This one emerges around 32 weeks in gestation and is usually integrated around month 2. This reflex is responsible for facilitating hip movement and range of motion in preparation for crawling and walking. Now, to test for this reflex, you would just hold the baby in prone suspension and stroke one side of the spine from neck down to the bottom. The response you'll get is a lateral trunk flexion on the stimulated side. And the functional importance for this reflex is that it'll facilitate that trunk stabilization and balance, both of which are necessary for creeping and crawling. right? Next up, the palmar grasp reflex. This one emerges around 37 weeks in gestation and integrates by around month 6. To test this reflex, you simply place your finger in the baby's palm and apply pressure, which will elicit that reflexive grasp with finger flexion. It also increases tactile stimulation on the palm of the hand. So as you can imagine, if this doesn't integrate, there will be poor fine motor coordination, as well as poor motor development like grasping or releasing of objects, as well as hand manipulation skills. All right, up next we have ATNR, the asymmetric tonic neck reflex. This one emerges around 37 weeks and should be integrated by around month 6. To test for this reflex, you would position the baby in supine and simply turn or rotate the baby's head about 90 degrees to one side and hold it there for 5 seconds. What you'll see is an extension of the arm on the face side and flexion of the arm on the skull side. In other words, when the baby's head is turned to one side, the arm of that side will straighten out, while the opposite arm will bend. So you guys have probably heard this before, but it's often referred to as the fencing pose or the fencing reflex because ATNR kind of resembles that fencing position. Now, this reflex is a precursor to hand-eye coordination because it promotes our visual and hand movement in regard. But if it doesn't get integrated, there will be many limitations, including hand-eye coordination. And although we're not going to go through them all here, I do want to give you a few examples of these functional limitations that can occur with a strongly retained ATNR. And the first one I want to talk to you guys about is reading comprehension. And that's because with ATNR, it's very difficult, if not impossible, to cross the midline. And you've probably heard that before, but in case you don't know what it actually means by crossing the midline, it just basically refers to our body's ability to cross over to the opposite side of the body. So one side of our body crossing over to the opposite side of the body. And that includes the eyes. So when a child with ATNR tries to read from one side of the page to another, those eyes will stop at midline and skip. What happens then? You'll lose your place, you'll lose what you're reading, you'll lose the context of what you are reading. So inability to cross the midline will result in poor visual tracking as well as eye pursuit, which will greatly impact the ability to read and actually understand what you're reading. Secondly, the child will have poor handwriting. And to understand why this might be the case, I want you to think about what happens to the arm of someone with ATNR when they slightly turn their head while writing. It'll want to extend and open, right? That's because the head position will dictate the arm movement. So think about how hard it would be to write without moving your head or turning it side to side. I mean, I want you to simulate this movement right now. Take out a sheet of paper and try to write across. You will find that your head naturally follows your hand as your eyes are watching what you're writing, right? But for kids with ATNR, this simple task will be very challenging because with every slight head turn, the arm and hand will want to open and extend. Okay? Last one, and this is going back to what we discussed earlier, but I wanted to elaborate, which is poor hand-eye coordination. Because the movement of the arm is dependent on head position, because head position triggers it, this will cause asymmetrical movement or position in the arms, which will make it very difficult to bring both arms together to midline. That also means they'll have difficulty holding an object together in both hands, or to bring an object to the mouth, or even reaching for something that's in front of the body while looking at it simultaneously will be very challenging. Okay, so I know that was a lot of information, but clinical application is really important here. So I wanted to make sure I gave you guys some examples. I'd like to encourage you to pause the video and to go through these scenarios again while doing these arm and head movements yourself, so you can kind of understand it using your body and muscle memory to help really sink in this information. Moving to TLR, the tonic labyrinthine reflex. This reflex also emerges around 37 weeks and integrates by around month 6. Now there are two aspects of TLR, TLR prone and TLR supine. So to test, you would place the baby in prone, which will cause a total body increase in flexor tone. And conversely, when you place a baby in supine, there will be a total body extensor's tone. So depending on the position, you will either get an increase in flexor tone or increase in extensor tone. And if this reflex is poorly integrated, there will be profound functional limitations in movement, especially for a developing baby. I want us to think about why that might be, and I want to give you a couple examples. For one, if you have TLR, being in prone will make it difficult to lift and extend the head. Why might that be? Because in prone, there is an increase in flexor tone, right? So how about in supine? What functional challenge might you see there? Sitting up independently. Why? Because to sit up, you need to lift your head up off the floor, which means that you have to flex your neck. But what's happening to the body in supine? The extensor tone is dominating, right? That will make it difficult to independently sit up or roll over. And because the baby misses out on these important exercises like extending the head in prone or sitting up or rolling from supine, a child with a poorly integrated tonic labyrinthine reflex will have poor posture, muscle tone, and coordination, among others. Alright, so that concludes the first portion of our video. And now we're going to talk about reflexes that emerge at birth or shortly thereafter, all of which should get integrated at some point. And first up, we have STNR, the symmetric tonic neck reflex. This one emerges around month 4 and should be integrated by around month 12. And similar to the tonic labyrinthine reflex, this one has two aspects. So for the first testing position, you'd place the infant in the crawling position and flex the head. What you'll see is the arms bending in flexion and the legs straightening in extension, getting the baby's butt up in the air. And for the second position, you would place the baby in the crawling position again and extend the head. And the response you'll see here will be arm extension with legs bending and tucking underneath their butt. So in both cases, whether the head is flexed or extended from that crawling position, the corresponding movements are helping in preparing the baby for that really important milestone, crawling, by facilitating a static quadruped position, because this is essential. It's an essential precursor to crawling. Now, for me, an easy and simple way that I learned STNR was to remember that the upper half of our body is always doing the opposite from our bottom half. So in other words, when the top half, which includes the head and the arms, move into flexion, the bottom half, including the hips and the legs, will move into extension. And conversely, when the head and the arms move into extension, the hips and legs will move into flexion. Now we're going to talk about what might happen with a poorly integrated STNR. For one, a child with STNR would have difficulty sitting up from lying position in supine. Now, if you remember, a child with a tonic labyrinthine reflex also would have trouble independently sitting up from supine, but the mechanism is different here. For STNR, sitting up becomes difficult because to sit up, you have to lift your head in flexion to initiate that movement, right? And what happens when you flex the head? Well, in STNR, with upper body flexion, the lower body will do the opposite and extend, yes? So that means the legs and hips will extend, which will get in the way of sitting up. So that's for STNR. But if you don't remember the tonic labyrinthine reflex and can't really conceptualize or articulate in your own words the differences between these two reflexes and the different mechanism by which they may lead to the same functional impairment, which in this case is getting up to sitting from supine, then I really want to encourage you to pause the video here and really think about it, because this is important to understand that though the functional impairment may look the same, the mechanism by which they occur is different for STNR and TLR, and I really want you guys to understand that, all right? Next functional challenge is poor muscle tone and posture. And this might be one of the most common signs in children or students with poorly integrated STNR. Now, remember earlier what I said about the two halves of the body, the top and the bottom, doing the opposite movement? Well, think about that and imagine what it would be like for a child with a retained STNR to sit properly at a desk. Sit properly meaning both the arms and legs are bent, ready to work. Do you think that'll be a comfortable position or even a possible position? No, because when the arms are bent, whether because it's holding a book or writing, the legs will extend straight out from underneath, making them appear to be slouching. So what will the teacher say? Please get up, bend your knees, sit upright, and what do you suppose will happen then? The child will try to bend the knees, but now the arms will straighten out over the desk and the child will still slouch, but this time in forward motion with an outstretched arm over the desk. So either way, there's poor posture, there's slouching forward or slouching backward, and being forced to sit properly by the teacher will just lead them to fidget or squirm or wiggle or walk around the room. So this poor posture will have great impact on many things, including the child's ability to focus, to learn, and to complete tasks while they're in the classroom. And so you guys, learning the STNR, as well as all the reflexes that we're learning, isn't just about memorizing, as you can see, because by learning how these non-integrated reflexes affect our performance and our learning, we can begin to identify barriers as occupational therapy practitioners that others may simply label as lazy or distracted, and we can really help somebody thrive and maximize their potential. But to do that, we have to be able to properly identify the barriers and hurdles that are getting in the child's way of occupational performance so that we can begin to offer environmental support, adaptations, and strategies that'll allow the child to succeed and participate and navigate successfully in his or her environment. All right? So we just went over the ATNR, the tonic labyrinthine reflex, and the STNR, which took a bit longer than others because these are really important and sometimes difficult to conceptualize. But for the remainder of the video, we're going to be picking up the pace and going through the reflexes quickly. All right? Continuing on, we have the Landau reflex. This one emerges around month 3 and is typically integrated between 12 to 24 months, so between 1 to 2 years of age. And to test for this reflex, you'd hold the baby up horizontally in air in prone suspension, and the baby will respond with total extension. That's total extension of the head, the trunk, and the extremities. What that'll do is help break up the flexor tone, which will facilitate prone extension, which is important for posture development. This reflex is also referred to as the Superman pose. You've probably heard that before. And I guess it kind of looks like Superman, but when I was studying, and to help me remember this one, I always associated the word Landau with landing. So use your imagination here and try to visualize a plane landing from the sky. Doesn't it kind of look somewhat like a baby held in prone suspension with its arms and legs in full extension, kind of like the wings in full extension? So this is what I picture when I think of Landau, the plane landing. Landau, landing. Landau, landing. Okay? Now, we're going to talk about writing reactions. These are very important because it's what helps us assume a position by maintaining or restoring the normal position of the head in space. It's also what helps us maintain our alignment of the head to the trunk as well as the trunk with our limbs. And in babies, it helps to initiate rolling, and you'll learn all about that in just a minute when I talk about neck writing and body writing reactions. But these are basically reactions that develop after birth, and they're critical for babies because it helps them develop through important milestones like head control, rolling, crawling, and eventually standing. So without these writing reactions, individuals will have very difficult time doing simple things like getting up or sitting up, kneeling, or getting out of bed in the morning. So let's get started. The first one we're going to talk about is neck writing, also referred to as neck writing acting on body. It emerges around month 4 and integrates by age 5. To test for this reflex, you place the baby in supine and fully turn the head to one side. What you'll see is the entire body following and rolling in the direction of the head in what's called a log roll that brings the body into alignment with the head. All right, now this reaction is essentially what allows the baby to roll because the baby will use this reflex in order to transition between supine and sideline. So that's neck writing, an important precursor to crawling. Another writing reaction I want to talk to you guys about is body writing, also known as body writing acting on body. This one emerges around month 4 and is typically integrated by 5 years of age. So that's the same as neck writing. Another similarity to neck writing is the fact that this reaction also helps to facilitate rolling from supine to sideline position. The difference, however, is that instead of using the neck to initiate the roll, you would use the leg. So the test position would be the baby in supine, and you would bend one hip and knee toward the chest. What you'll see is segmental rolling in order to maintain that head and body alignment. Next, we're going to talk about a writing reaction that does not get integrated, which brings us to the third and final portion of our video: lifetime reflexes, reactions, and responses. The first one is optical head writing, which emerges at or soon after birth and persists throughout our lifetime. This one is essentially what allows us to correct the orientation of our head when the body is taken out of its normal upright position. So in a baby, this is what you do to test for this reaction. You'd hold the baby suspended vertically and slowly tilt off center by moving it side to side, forward or backward. And the response you'll see is upright positioning of the baby's head, which means that it is able to orient the head in space. And the reason why this one is called optical head writing is because the baby is using his vision or her vision or responding to visual cues in the environment to maintain that head in the upright position, hence optical head writing. Now we're going to talk about a different type of head writing. This is labyrinthine head writing, which is similar to optical head writing in many ways. For one, there's similar onset, which is at birth or shortly thereafter, and also the functional importance is the same, which is to orient the head in space like optical head writing. But the difference here is that you would cover the eyes for testing with labyrinthine head writing, which means that the baby or whoever is testing will not be able to use any visual cues or information in the environment for orientation. But even without visual cues, the subject will be able to maintain that head in upright position and rise to vertical in relation to gravity as the body follows the head in movement. So how's that possible? Well, the clue is in the name, the labyrinth, which is a structure in our inner ear that helps with balance and coordination. And I frankly never had appreciation for this tiny little structure in my ear until I was diagnosed with Meniere's disease, because with this disease, I get frequent fluid buildup in my labyrinth, which leads to vertigo that completely wipes me out and gets me disoriented. And whenever this vertigo strikes, everyday simple tasks like sitting up from bed or walking, they get compromised and extremely difficult to do because my balance and coordination are affected. So the labyrinth plays an important role in balance and in helping us to stay oriented. So remember that when you see the word labyrinthine head of writing, it's just a fancy name that indicates the ability to maintain and orient the head in space in upright position. Okay? Alright, so for the remainder of this video, we're going to talk about protective and equilibrium reactions, which I'll go over pretty quickly because they're straightforward and easy to understand. First up, let's talk about the downward parachute protective response. This one emerges around month 4 and it persists. To test it, you would quickly lower the baby toward a surface while it's suspended vertically, and what you'll see is extension of the lower extremities, so the legs will straighten out. And this response persists because it helps us and provides us protection against the impact of a fall or in anticipation of a fall, like a physical defense. Next, forward parachute, same idea. The forward parachute emerges around month 6 and it persists, and to test you will quickly tip the baby forward while vertically suspended, which will result in rapid upper body extension of the neck and upper extremities in anticipation. Again, this is a protective response to brace against the fall to support the body if needed. Sideward parachute. This one emerges around month 7, and as the name suggests, you would tip the baby off balance to the side while in sitting position, and the arm will extend and abduct to the side in anticipation of or to prevent a fall. And finally, backward parachute. This is another protective response that emerges around month 9 and persists. And this is observed when you quickly tip the baby off balance backwards. What you'll see is backward arm extension or one side spinal rotation with arm extension. Okay, so that was four protective responses that we covered: the downward, forward, sideward, and backward parachute. And one thing I do want to note and point out real quick is that of these four protective responses, the downward parachute is the only one that results in extension of the lower extremities. So the forward, sideward, and backward parachute, they resulted in arm extension, right? But the downward parachute results in leg extension, so lower extremities extension. Okay? Finally, equilibrium reactions. Oh my gosh, we almost made it, you guys. Only 4 left. And I'm going to lump these 4 equilibrium reactions together, not only because I'm really tired now and I think I'm losing my voice, but because these actually all have same responses as well as functional importance. So the only difference that I really want you to note here is with the age of onset as well as the testing position. You'll note that even the testing position is really self-explanatory because all the clues you need is actually in the name itself. So let's start with prone tilting, which emerges around month 5. This is basically when you place and position the baby in prone on a tilt board or any supporting surface, and you would raise one side. What you'll see is the spine curving on the raised side with both the arms and the legs extending and abducting. And the functional importance is that this allows for maintenance of the equilibrium without having to use the arms for support, as well as allowing for postural adjustments. Okay, now to imagine this one, I like to think of somebody like a surfer paddling on a surfboard, because every time the waves come and undulate from underneath, what's happening to that board? It's going up and down, right? So the surfer, the person on that board, would have to constantly make postural adjustments and maintain equilibrium even as the board is going up and down. And that surfer is using prone tilting expertly. There is that equilibrium reaction working for that surfer, okay? So that's how I like to remember prone tilting, by visualizing a surfer on a surfboard. For supine tilting, this one emerges around month 7, and as the name suggests, you would position the baby in supine on a tilt board and raise one side, and you would observe the same reaction with the same functional importance. And quadruped tilting, this one emerges around 9 months, and for testing, you would position the baby on all fours and again raise that one side. Last one, we made it, guys. So let's wrap it up. Standing tilting. This one emerges around 12 months, and to test, you would position the baby in standing on the tilt board and again raise that one side. So remember, equilibrium reactions are here to help us sustain or keep a position, and they're the first line of defense against falling. They allow for postural adjustments and alignment when our body's center of gravity is altered, and without it, it would be difficult or maybe even impossible to maintain or recover balance when we're engaged in activities like surfing, as I mentioned previously. All right, so that concludes today's video recording. And now that I'm done, I am about to go and do something fun. I hope this video was helpful, and until next time, take good care, be good to yourself. Good luck on preparing for your exam, and remember that there's nothing here that cannot be learned or mastered. We can do this. All right, guys, until next time, bye.